Hello, and welcome to our podcast series featuring OrthoFX experts. I'm your host, Danny Poelman. In this series, I speak with doctors who have made the switch to OrthoFX, a new generation of aligners designed to improve predictability and support patient compliance. My guests today are two general dentists who practice together at Dental Care of Corona in California. Their large practice offers comprehensive care with both general and specialty services under one roof. Today, we'll discuss their experience with OrthoFX and the aligner treatment and why now may be the right time to consider a more advanced aligner system. So let's dive right in. My first question for you guys is, can you share a bit about you, your background, how long you've been practicing, and the kind of services you offer?
Sure, Danny. So like you said, we've been in business together for a long time, 25 years, right? We opened our practice. I'm Dr. Rakesh Patel. This is
Shital Patel.
And he's a good buddy too.
Yeah.
And we grew up together, we know a lot about each other. We focused on complete care for our patients. And part of that, when we actually started very early on with aligner therapy, because it just kind of fitted, it's a cleaner, it's what patients want now. It's modern, and it works. So we tried to focus on a system that would help our office grow.
Amazing. So how long have you been with OrthoFX again?
It's been, 10 years, 12 years?
I think we were the number 3 office.
Yeah.
Wow. A long time.
That's right.
I love that. So you have a lot of experience to speak from. I'm so glad we got to have you on the show today. Can I ask, before switching to OrthoFX, you were doing aligners, right? So what challenges were you running into with your previous aligner system that made you think, I want to look into this other company called OrthoFX?
The thing that drove us crazy mostly was people falling off track, right? So maybe they slacked on wearing their aligners for a couple of weeks. Life happens. They complain of aligners not being comfortable. That probably didn't help with compliance. And that leads to new scans, new treatment plans, increased chair time. It just gets frustrating, not just for us, but for the patient as well. We have to deal with treatment fatigue, cases lingered, and just didn't get the outcomes that we really wanted. It was kind of a vicious circle, really.
Can you tell me a little bit more about compliance? Just what was it specifically that made compliance harder before switching, and how has the compliance gotten better after switching?
Yeah, I think just the OrthoFX material, patients just, every time they put it in, even their first aligner, they always comment on how comfortable the plastic is, especially patients that have had other aligners. They really notice the difference. I think the quality of the plastics is what really stands out.
Okay. And then tell me a bit more. How did you discover OrthoFX, and what made you actually decide and take the leap? Because for a lot of doctors, they learn about something that could be better for their practice or their patients, but they're so worried about how it interrupts their workflow and what they're used to. What was it that made you actually decide to do it?
Well, we heard about the rescue aligners. We thought, oh, wow, that's a great idea, because the biggest frustration we had was just patients falling off track. They'd come in and they would be so off track that we'd have to stop treatment, do another scan, waste more time. And then for some reason, I don't know why, we'd get a new scan and there'd be like another 100 aligners again. So it wasn't just a few that, that was supposed to be, but it was just a lot more. So very frustrating. So the rescue aligners was just something that kind of, wow, what a great idea. That, and also the 12-hour wear aligners. What a great marketing tool for a patient. Also, the FXOnTrack. We have college kids, they're out of state. It's like, hey, here's all your aligners, Johnny. Just make sure you upload your photos every few weeks. OrthoFX is going to look at them. We'll look at them. We'll make sure you're on track. If there's any issues, we can sort it out. So that was just the nail on the head for us.
Okay, so some of our listeners might not know what rescue aligners are. or
Sure.
what FXOnTrack is. So FXOnTrack is remote monitoring, and rescue aligner is meant to rescue from a refinement. Could you, maybe each of you could take turns describing what each of those are? Could you explain kind of how it works and how you use it and what benefits you see from using them?
Sure. Sure. So let's just say you have a patient who's been wearing their aligners for, let's just say, 10 weeks. And usually I will put in my prescription every 6 weeks, please upload your own photos. They have their own cheek retractors. They can use their cell phones, take their own photos. They upload them into the portal. And straight away, OrthoFX with their computer, the AI, and the clinicians will know just by how the aligners, what stage they are, whether that tooth or those teeth are where the model was predicting them to be at. And if it's not aligning up, they're like, hold on, time out. We need to do something. They'll let us know as well. So please contact your patient. We think they're off track. And then we can send them basically a rescue aligner is just a set of aligners to just do enough movement to get them back into what they need to do for their next proper aligner. So then we can get them back on track.
And the great thing about that is they don't even have to come into the practice to do that, right? So there's no chair time. Everything gets done remotely. So, I mean, that's probably been one of the biggest impacts since switching to OrthoFX is having that combination of the remote monitoring with the rescue aligners. It really helps us keep our patients on track with their treatment. And we talked about compliance earlier. I think the two biggest factors with compliance are, number one is obviously the fit of the material and the aligners being comfortable. But secondly, I think the remote monitoring, the FXOnTrack, keeps them a little bit more accountable to them being compliant with wearing them. So
I love what you said about accountability and having the patient take more ownership in their treatment and their compliance. I think that's a big factor. And they wear those for 22 hours each week, and they can continue on with the aligners they already have at home. I love how that's benefited your practice, and thank you so much for sharing.
Some of these patients, I'm just kind of, they do some amazing photos, I'm kind of impressed when they take their own ortho photos. So it really is, and it really engages them and correct ownership. That's what they need.
Yeah, for sure. Okay, so let's talk treatment outcomes for a bit with FXClear and AirFlex. So FXClear is the 22-hour option with OrthoFX. AirFlex is the 12-hour option. That's a hyperelastic polymer. What are you seeing in terms of treatment outcomes?
Take this one. I mean, FXClear has just been super reliable for us, right? It's compliance, just the material, tooth movements. We've just had less do-overs, cleaner results. The patients love that they don't stain, so that's a big deal for them. They're more likely to wear them. Who wants to wear yellow aligners, right? So, and then the AirFlex has been great for those people where it's a specific kind of patient where they're busy people, right? Maybe they have a job where they don't want to wear them during the day. So it's been a game changer for that specific kind of patient. It's the only 12-hour wear aligner on the market, right? It's the FDA approved, so it has great backing, and we've had great success with that as well.
That's wonderful. Can you share a case story that really stands out to you?
Sure. We have a gentleman, Alex, nice gentleman. I have a photo of him right here. So this is Alex. This Alex right there. Look at that. Scary. He went to orthodontist, he didn't want to do 2 years of, a tin grin, I call it, right? And then
Tin grin.
and then he went to the other competitors. The price was just ridiculous. So he came to us. We've done thousands of aligner cases. So he's a bit complicated. We did some, slimming of some teeth, but, and he had 56 aligners. But boy, this gentleman was compliant. And look at this. Ask him,
Yes.
you tell me, is he happy or what? Right?
That's with no additional aligners.
No
That was
additional
one
aligners.
clean case all the way.
This is why we do what we do. We give people their smiles. So that's
Yeah.
worth $1 million.
What was his reaction like at the end of that case?
Oh, the confidence. He dressed differently. If I showed you his photo, he has beanie on and he just looked like, some guy off the street. And then after that, he came in nice, and he's just a joy to treat. Very, very good patient.
And he's referred us a ton of patients.
Nice.
That helps.
Yeah. You didn't just give him a smile upgrade, you gave him a life upgrade, sounds like.
Yeah.
Love that story. Okay, so then can you tell us a little bit more the impact on your office of adopting the OrthoFX system? Things like staff workflow or training or support that you get?
We were a little nervous about the learning curve, but honestly, it's been pretty painless. The OrthoFX team has been so supportive. The software is so straightforward. It's just very intuitive. It's very easy to understand, and the staff took it up straight away without any issues. So it's been much easier than we thought it would be. It's actually made the office much calmer. Fewer fires to put out. The access to the support team has been great. So it's been great.
Yeah, that's something that as a company, OrthoFX really prides themselves on, is that hands-on support, making sure that's available at your fingertips. I love that about the company. So speaking of tin grin, people who come for aligners, they don't usually want any metal in their mouths, right? And we have a fun new feature being released this summer, fully integrated buttons in the aligner. We're the first and only aligner system to have it. So just look for that if you hadn't heard of that yet.
Awesome.
Can't wait.
Yeah, I know. Me too. I'm excited. So question, why do you think now is the right time for doctors to reevaluate their aligner system that they're using?
Well, I think it's because a lot of doctors, they're kind of running on autopilot, with whatever system they've just been kind of started with. And I get it, switching anything, in a practice feels like a big headache, especially for the poor staff. So, but the technology has moved, it's there, materials and technology. So, the 12-hour option, the way they handle patients, going off track, the remote monitoring, this stuff didn't exist a few years ago. And if your current system is giving you headaches with corrections and compliance, there are better options now. It's worth at least taking a look. What's wrong with that? So we know overhead costs are kind of going up every year, and efficiency is more important than ever. So, it all boils down to your increased, profitability in your practice. So OrthoFX has definitely been the perfect fit. So you get just more bang for your buck with OrthoFX, basically.
Okay. Can you tell me more about that? How does that happen with OrthoFX specifically?
Well, because they're less time in the dental chair, so we can use that dental chair for other procedures. So also we're not doing as many refinements, like redoing cases, making extra aligners, so we're not wasting our time there. A lot of work is done out of the clinic, with the FXOnTrack and the rescue aligners. So things are corrected before the patient comes into the practice. So again, we're not wasting time in our office. And the material is much better, and the patients have more ownership.
Yeah. And the material is patented, and OrthoFX is the only one with it.
We actually met the gentleman, the materials engineer, Locke Pham.
He's amazing.
Poelman, and I could talk to him for hours. I tell you, he's a very interesting guy. But just the technology involved. People just think it's a piece of plastic. I've told patients they think it's a piece of plastic. I said, this is so much technology, and this thing has like incredible technology in it.
Yeah.
Know that it's not just a piece of plastic.
I wish all our interns could meet Locke Pham, because they know how much work went into creating plastic.
OrthoFX was just a no-brainer because we were so frustrated with our other, with the other guys. It's just night and day. The support is amazing. That's my number one thing, is how well you're looked after as well when you have an issue. And hands down, OrthoFX is just amazing.
That's so awesome. Okay, so you mentioned for doctors and teams who are having some pain points, maybe go look into the new system. What about the ones who are comfortable and don't have any current pain points? What would you say to them as to why now might be the time to look into something different?
Dentists, more than other professions, we're just creatures of habit. We don't like change. But this change was one of the best things that we did at our office. I mean, I wish we'd done it sooner.
All right. I just want to ask, last thing here, is there anything else about your experience with OrthoFX that you'd want to share with someone who is thinking about trying a new aligner system?
Just the efficiency of it all, the simplicity of it all, the technology. I mean, it's just, like I said, it's a no-brainer. Why would you do something different?
And also, you still get the personal touch with OrthoFX. It doesn't feel like a huge corporation. Like you said, we got to meet the main guy, the plastics guy, the engineer that devised the plastic, right? So it just feels like a small, nicely run company.
Oh, one more thing. Our videos come back very quick. We do our prescriptions for the patients, and within 2-3 days, we got the video back, even less than that, so we can just get rolling on this. So once it's approved, right, then we can get the patient in and it's done. So that's a quick process. So that also helps with our efficiency.
Perfect. No brainer.
No brainer.
All right. Well, thank you so much, Dr. Shital Patel, Dr. Rakesh Patel, and thanks everyone for your time today. If you'd like to learn more about OrthoFX or how to get started, please visit orthofx.com and click Become a Provider. See you next time.